Welcome back. Your calls can still come in while we continue talking about the bad bite or malocclusion. When the braces are put in, the only way teeth can be aligned, as I see it, is that they're going to move.
Yeah.
Now, if the teeth move, what happens to the space they leave behind? What happens to the structures holding up the teeth?
Yeah, it's very interesting. The thing about having braces on, we're able to give patients braces and correct the way the teeth are arranged because the teeth can actually move. And it's because of the principle of the fact that the teeth can move when you apply light forces to them. They can move gradually. There's something we call sliding mechanics. I'm trying to break it down to the simplest terms, but it means that if you apply minimal force to the teeth, as you see with the brackets and then the wire, you can actually gently slide the teeth into position.
Okay.
And in the course of treatment, I mean, we slide the teeth into position, and if there are any spaces left, we can actually close those spaces. The fact that the teeth can move once the minimum amount of force is applied means that we can use that to do a lot, and that's the principle we use to correct the protrusive teeth, the crowded teeth. We can actually also close those spaces.
Now, I want to talk about a certain different kind of teeth.
Yeah.
Maybe somebody has good dentition and everything,
yes,
but you end up losing some teeth in the process as you grow. You
True.
pull out a few,
True.
you know, and
True.
all that.
True.
And there are now spaces.
Yes.
Is there provision to help such a person? In fact, doctors say that the teeth slide into those spaces.
True.
So what do you do to keep everything together?
Yeah.
Your dentition correct?
You know, in dentistry, the orthodontist is a specialist that takes care of arranging the teeth. But there are many times when we have interdisciplinary treatment in the sense that it's in dentistry, but you're working with the restorative dentist, the prosthodontist, the oral surgeon. For those kind of patients that have probably lost teeth in their adult years and teeth are starting to drift, normally they have what we call multidisciplinary treatment between the orthodontist and the restorative dentist. And so we can bring those teeth back together because we can move the teeth. Because of that principle that we can move the teeth, we can bring those teeth back together. And those spaces that have been left where those teeth were removed, we can, I mean, the ideal thing now is an implant. So if there was a missing teeth,
fix new teeth in
yes,
there.
you fix new teeth in there.
If the teeth are not fixed, does the gum fall in when the person ages?
Yes.
So that's why some people look like they have sucked in
Very
gums.
true, very true. You age faster. If you have lost teeth earlier on in life and you don't replace them, there's a tendency for you to look older because the cheeks and the bone, your cheeks sink into that area where the tooth loss has occurred.
Okay, is there any provision in all this treatment for tooth grinders? People who grate on their teeth and their teeth are actually reducing in height. Is there help for them?
Yeah, there is. People who do that, we say they have parafunctional habits, the bruxism. And sometimes for them, it's the first thing is to find out what is causing it. The truth is that sometimes we can't even it's very difficult to put a finger on the cause. Often it's associated with stress. What we often tend to do for them is in some ways palliative, depending on how severe it is and when it occurs. So mouth guards are very commonly used for them. We give them night guards that they wear. They are thick wax wafers that when you bite in, they are soft, but when you wear them particularly at night because that's when they turn to occur.
Okay.
It reduces the effect of the teeth coming together.
Okay.
So
finally, in 30 seconds, 20 seconds, do you sometimes do surgery?
Well, we don't do surgery as orthodontists, but we work with surgeons. We work with the maxillofacial surgeon in particular for cases.
So that when you fix the teeth, the face isn't crooked or something?
Yes, particularly for people who have very severe jaw discrepancies, where the top jaw is really far ahead or the bottom jaw is really far behind, where even if you straightened out the teeth, the patient wouldn't look good. So the surgeon, we work with the surgeon. We arrange the teeth, the surgeon fixes the jaws.
It was 20 seconds I gave you. We've got to close. We've come to the end of the program. Thank you so much for coming, Dr.
It's been a pleasure. Thank you very much.
Thank you for being with us and calling in. Have a lovely day. I am Mary Alale Yusuf.